Does anyone use LDN to support patients with acne or asthma? Do any of your panel have a comment with respect to that?
The first case I presented, she had asthma, and she reported that her asthma significantly reduced. And Eugene is a place where you've got asthma, allergies. Our pollen level gets up, well, right now it's probably around 500 or 600 parts per million, which is astronomical. So, yeah, she was able to reduce her inhaler. She didn't use her inhaler in the evening because she didn't have symptoms, and that's all LDN. I use LDN personally to manage my hay fever, and I don't use histamines other than a couple weeks out of the year. Another client of mine, we weren't targeting asthma, but he noticed his breathing was easier. His allergy symptoms were reduced.
I would also say it's going to be more effective on immune or inflammatory mediated, right? If you're reacting to something versus it's as induced or something like that, right? Because the mechanism's going to be the same reason it works for mast cells. You're going to modulate the immune system. You're going to reduce inflammation, et cetera. So like eosinophilic type responses. Right?
We have used it for asthma quite a fair bit and hay fever as well at the clinic. Basically, it just reduces the severity of attacks if they were to get it. For those who have it milder, quite frequently they just end up just keeping their asthma medications and not really needing to use it. Acne is interesting actually, so never really thought to use it there, but I will look into it now. That's interesting.
And just quickly, with asthma, asthma's doesn't all have a trauma component or a early life trauma or attachment trauma, but there's I think a correlation with many asthma patients with attachment issues, and naltrexone potentially could help that. And there's a lot of medical trauma, and thinking about all the other things that aren't labeled as psychiatric or psychological, but end up being really life-changing, horrendous to go through. You've got a trauma you're dealing with right there. And LDN then has that double effect of, well, it helps quiet the reactivity to the medical trauma you've been experiencing for years.
I think Sarah Zelsdorf has been prescribing it for asthma for quite a while in her pediatric patients with that intention to treat for that non-exercise induced, but for that reactive inflammatory airway disease, which we use a ton of corticosteroids for. Same with other pulmonary conditions. In fact, I think there was 12 that was listed in a presentation from 2 years ago in Carbondale. Just saying. Yes.